Hello, everyone. It shows that we are live today. I have Dr. Pamela Gaudry who is joining us on today. We have some great information to get out to you guys. Give it just a few more seconds to kind of just make sure everything is kicking in, that you are getting the notifications, that you are ready to have this discussion so that you can get the information. If you have any questions or comments, feel free to put them in the chat, and as they come through, we'll try to address them. And if for some reason we don't see them, sometimes they don't always come through. I'll go back and look through the chat, and then I'll answer your questions accordingly. But welcome and thank you so much for watching and for tuning in. And as you guys know, I am still obsessed with the weather. I'm almost kind of over it because it keeps flip flopping. And just when I think I have it figured out, then it says, nope, try again. And that's almost kind of like Savannah weather anyway. But the weather seems pretty nice on today. Started out a little cool and then it warmed up. So you can tell me where you're watching from. Tell me what the weather looks like where you are. That way we can see what you guys are dealing with. Dr. Gaudry is in Savannah, but we're on two ends of Savannah. So sometimes it could be sunshiny over here and it could be raining on her end of town. So Dr. Gaudry, what does it look like on your end? What are you
It's
experiencing
beautiful.
today?
It's gorgeous. It's gorgeous
I
out.
know, see? Right. Oh, someone said Miss Janice says, hi, Dr. Pam. We're very
Hi,
excited to
Janet.
see you.
Thanks for tuning in.
I know. Thank you for joining in. Thank you. If there are any others who want to chime in, go ahead and say something. If not, we are going to get started in just a second because I don't want to waste your time. I want to make sure that we are efficient because we have some great information to get out to you guys today. Oh, look at this. We have Kaiser that says they are so excited to learn today. Lori says she's excited. Yes, let's hear it, ladies. We are excited. I want some men to come on and say that they are excited too, because what we're talking about today is not only going to affect the women, it affects families, it affects everybody. So let's just get into it. Welcome to Lessons Beyond the Stethoscope. And here we provide practical health tips and tools that you can use in your everyday life. Because what we understand is that your life overall affects your health. This is episode 10, How to Enjoy Life After Menopause,
Mhm.
Symptoms, Treatment, and Intimacy. Today we have joining us Dr. Pamela Gaudry, or Dr. Pam. She is affectionately known by her patients. She is a board certified OBGYN and has been practicing in Savannah for 30 years. She started her educational journey at the University of Georgia in Athens, and from there, she went to medical school and completed residency at Medical College of Georgia in Augusta, Georgia. In 2007, she did some additional training in menopausal medicine and intimacy counseling. And her goal is to help women get through menopause safely, sanely, and well educated. And she does this in several ways. She has a medical practice, and it's called the Georgia Center for Menopausal Medicine and Direct Primary Care. So that's where she sees her patients. She wrote a book called Love, Sweat, and Tears, which was also into a feature-length film. And it's considered a docu-comedy, and it features the comedic genius of, get this, Joan Rivers and Lynn Coplet. So you guys know you have to check that out. And she's also, after she does all the things and all of that, she still has time to be a mother, a grandmother, and a wife. And I would be remiss if I did not mention that she is also a diehard Georgia Bulldog fan. So thank you so much, Dr. Pam, for joining us today.
Thank you for having me. I'm excited to be here.
So thank you. So, Dr. Pam, according to the National Institutes of Aging, over 1 million women enter menopause each year. 1 million. And once I
Yes.
started thinking about that, I said, that's a lot, right? So if we have that many women entering that phase of life, why aren't we talking about it? Why aren't people discussing it? And with you, you decide to be a lot more intentional to have these discussions with your patients. So what is it that made you say, let me start having these discussions with my patients and help them go through this process of life?
Oh, well, it's very easy how it happened. Actually, 6,000 new women per day enter menopause.
Mm.
And so there's lots of people out there who need help, but OBGYNs are obstetricians. And we didn't always go into OBGYN because of doing pap smears and pelvic exams. You deliver a baby and it either gets you or it doesn't. And it got me bad and I loved it. But my husband got sick in 2005. And in 2007, I had to stop doing OB. And when I stopped, all these women started coming in going, "Oh, I'm so glad you're not delivering babies anymore. Now I can talk to you about menopause." And I was like, "Oh my gosh." I had no idea that they were out here struggling because my, I loved delivering babies and that was my life and that was my love. And, I always felt that God was in the room with me when a baby was born, and I could never be closer to him until, except delivering a baby. But then when I couldn't do that anymore, I realized that I didn't have enough training. So I went back and I got a certified menopause practitioner status, and I actually went back and got a sex therapy certification, which sounds odd, but women were coming in saying to me, "I've never had an orgasm and I want you to tell me how."
Mhm.
And I would think, "Well, I can tell you how I like it." But I didn't know exactly how to help them. So I got the sex therapy training. It took me about 4 years to get all that extra training because I still had to practice. And the rest is history. I just realized there were not enough people telling women about what to do in menopause,
Mm.
what to expect, and how to maintain their intimacy. So I wrote the book, and then it got made into a feature film. So that's kind of how. That's the brief track.
Well, it's great that you mentioned that because it tells me a couple of things. And one of those things is that your patients trusted you enough to say, "Okay, I'm dealing with this. I trust you enough to try to help me with this." Because again, a lot of people aren't talking about it. Women will talk about it a little bit more often than men, but some other women may not be as comfortable coming out saying, "I'm having these changes. Like, what do I do?" They just say, "My mom went through this and this is how she dealt with it. And I guess this is just how life is going to be." So I'm happy that your patients felt that way and felt very comfortable discussing that with you. The other reason why I feel like people don't discuss it is because of the fear of unknown. They don't know about it. They don't know how to approach it. These things are happening. Is this normal? Is it not normal? I heard this, I heard that, but they have nothing to really hang their hat on. And so today we get a chance to demystify all of this for people, which I'm excited about. And one of the things I want to do is just start with the basics. Like, what is menopause? And I think before we even talk about menopause, we have to talk about perimenopause, which a lot of people don't talk about. Everybody throws the word menopause around, but there's also perimenopause where people may be experiencing symptoms and things of that nature. So, can you just walk us through that? Like, what's the difference between the two?
So peri just means around. So perimenopause is really around the time of menopause. Menopause is when you have not had any periods for 12 consecutive months. And that the average age in this country is 51.4 years. Most people on average will enter the perimenopause or start having symptoms around age 47. From the time you start having real symptoms to the time it completes takes about 4 years. So, but the bell-shaped curve is from 40 to 60. That's why it's so difficult to get pregnant after 40 because your ovaries start failing. How I like to tell my patients is think about puberty in reverse. Let's go to puberty. Not really because it was terrible, right? So,
Right.
puberty starts around age 8. Those chemicals or hormones start being produced by our brain and ovaries around age 8. And you don't look any different. 8, 9, 10, you don't look that much different. But there's a huge difference between an 8-year-old and a 13-year-old, right?
Mm.
And when you get your period, and that's not the end of puberty. Puberty goes on to around age 18 when those hormones kind of get stabilized. From then, it's a slow buildup. But think about an 8-year-old and a 13-year-old look very different. A 13-year-old and an 18-year-old look very different, right?
Mm.
So it takes that long for your ovaries and that negative feedback system in your brain to work. So then you have about 20, 25 years of relative stability where you're having regular periods or fairly regular. But then around age 40, your ovaries start to fail. And that is a slow downward turn too. So it takes about 10 to 15 years for your ovaries to fail. And during that time, you go through those same things as your ovaries fail.
Mm.
It's just puberty in reverse. But think about what teenagers do, or girls and boys going through puberty. They're happy one minute, they're pissed off the next, they're slamming doors, they love you one minute, and then they're sobbing and screaming at you, and you can't have a conversation with them. And but think about a menopausal woman. When their ovaries are failing, they get angry for no reason. They cry at Hallmark commercials. They can't watch anything on the internet involving dogs, without bursting into tears. Their husband may make them um, go crazy, and they're screaming at the kids. And then the next minute they're crying and don't know what happened to them. So it's puberty in reverse. And if you think about it like that, the emotions are almost identical, really.
Mm.
So some women start having perimenopausal symptoms around age 40. But on average, it's around age 47. Hot flashes start at night, um, and the periods start messing up. They get very heavy, and then closer together, and then they'll start getting farther and farther away until they stop. And that's when menopause is, when you have no periods for 12 months.
Okay, that's really good. I like the kind of puberty in reverse. But when you mention it, people are like, oh no, I don't want to go back to that thing, because that time, like you said, it's not one of those moments that we were all excited about. But that is a good way to look at it, because it shows you, okay, these are how those symptoms and everything can present. Talk to me about those other symptoms. Like you talked about those, but like vaginal dryness and some of those other things that women will experience as well.
So it's all from the lack of estrogen. When you start losing your estrogen, or it shuts off completely, your skin changes, the collagen and elastin in your skin. Women start getting wrinkles, and they don't have that young, fresh look anymore. Women will come in, they're like, I aged overnight. And then there's a central weight gain from above your breast to below your butt,
Mm.
and your stomach gets bigger. We can't figure that out, but there is a central weight gain. It's almost like your arms and legs get smaller and flabbier, but then your stomach and breasts and butt gets bigger. Um, Estrogen is 100% um, responsible for protecting your vagina. So I tell my patients, your ovaries took care of your vagina for 51.4 years. After that, it's your turn. And if you don't take care of her, if you don't give her estrogen in some form or fashion, she's going to dry up, and she's going to dry up fast. And you lose the folds in the vagina. If you watch the movie, you'll see I put an accordion in there because, excuse me, that's how the vagina works, like an accordion. It has folds in it, and when a man goes in there, it stretches it out. But if you lose those folds from lack of estrogen, and it's not going to stretch, and it will hurt. And then the tissue gets so thin
Mm.
that some people even feel like it's razor blades in their vagina. So dry eyes, dry mouth, um, everything kind of dries up. You lose the glandular part of your breasts, and then they turn a little bit fatty, and then gravity sets in and they fall.
Mm.
Um, It's not for sissies. 25% of women will have severe enough symptoms to seek medical help. So, I have a practice based on the fact that 25% of those 6,000 a
Mm,
day don't do well and need help. A lot of women do fine. Some women have no problem at all.
right.
Um, so it's just all. It probably is a little genetic too. If your mom did okay, you'll probably do okay.
That's a good point, guys. If you are just tuning in, I am here with Dr. Pam. She's a board certified OBGYN, and she's also a certified menopausal practitioner. And I like to call her like the menopause expert guru because she like is very well versed in it, has done a lot with treatment with patients. And speaking of that, like how do you approach treatment for those 25% that come through your doors and say, "Hey, Dr. Pam, something this I just cannot continue with this." And usually they're probably showing up on your doorstep because they are symptomatic. Do you say, "Let's get labs"? Do patients say, "Can you check my labs? Can you check my hormones?" Like, how do you approach that?
Great question. Um, my first question is, are you okay? Well, it depends on the symptom. Are you okay with taking estrogen? Some women and most physicians are terrified of estrogen
Mhm.
from a medical legal standpoint, from a hurting their um, patient standpoint. I'm not terrified of estrogen at all. I love estrogen. I love ovaries and I love working ovaries. And when they're not working, I love estrogen replacement therapy. There are some risks. They're small risks, but it's been blown up way out of proportion. So if they come in with hot flashes and they're miserable and they're changing 3 times at work and they're dripping over their papers at work and they can't take it. If they're willing to take estrogen, I put them on estrogen. Now, if they're just having vaginal symptoms and they're tolerant of their hot flashes, which are annoying but not life-changing and miserable, I tell them, if you're not gonna take systemic estrogen, which goes through your whole body, then for goodness sakes, protect your vagina. So I tell them I'm the vagina whisperer. You have to protect your vagina. So, and even if somebody goes off systemic estrogen because their hot flashes aren't bad anymore, which does happen, I tell them we have got to protect our vaginas because now we are in the Viagra generation. It used to be women and men kind of slipped out of intimacy, sexual intercourse together because the men couldn't really have a good erection after 60, 70, and women's vaginas were drying up and everybody just kind of let it go. But now, since Viagra came out in 2000 and we have Stendra and Cialis and Viagra, Levitra, they have lots of options to be able to have intercourse until they die. So you have to protect your vagina to protect your marriage. And most women want to keep that intimacy. It's just that it hurts, and they they don't know what to do. So there are 6 options to protect your vagina. Is this a good time to go through that? Um,
We
so
can one second before we go there because I'm definitely going to get into it, and I know that's a lot of reason why people are
I know.
tuning in. Before we get there, can you just touch a little bit on just a little bit more on the estrogen because I again like physicians were really scared like nope I don't do that you got to go see someone else and then patients were like nope and you even mentioned in your documentary how a lot of women quit cold turkey and just like oh this came out about estrogen I'm not taking it and then everybody's miserable. So can you touch a little bit more on because you said that there are some risks with estrogen but they're very small and just give just a little bit more about that and how it really can like the benefits can outweigh the risk for most women.
right, and if you don't have breast cancer or a predisposition to blood clots, there's really no reason you can't take estrogen. Estrogen before 2002 we had everybody on estrogen because it protected your bones, it protected your skin, um, it helped your colon work better, your vagina was protected, it, prevented hot flashes. And back then, we didn't have any medication for osteoporosis. It was just calcium,
Mm.
vitamin D, and exercise. Um, Around 2000, Viagra came out. 2002, this big study called the Women's Health Initiative came out that told everybody to stop their hormone replacement therapy because they were going to get breast cancer. I could
Mhm.
talk for 2 hours on why that study is not a great study and that it was overstated by so much.
Mm.
I can't tell you. It's hard to just give a synopsis of that study. But that's when women and physicians and the lay public all got terrified of estrogen and people stopped it. And we've had more fractures. Um,
Mm.
it, People's vaginas dried up. And that is a big point because these women went off estrogen at the same time that Viagra came out. The divorce rate went through the
Mhm.
roof, and women were coming in and saying, "He left me for a younger woman." Like, he actually probably left you for a working younger vagina. Okay. And
Mhm.
you can get yours back and you can treat the problem if you use vaginal estrogen, which does not have the risk of breast cancer and blood clots. If you believe the Women's Health Initiative um, results, 8 per 10,000 women over placebo got breast cancer. So I feel very bad, that anybody would get breast cancer on hormone replacement therapy. Breast cancer is my nemesis, right? I mean, I live every day to find and prevent and treat breast cancer early. But 8 per 10,000 women is not that many over placebo and should not have changed everything about estrogen
Mm.
because of 8 out of 10,000 women. Um, the blood clots we've known, it's the same as birth control pills, right? Or when you put somebody on a birth control pill, you tell them the main risk is blood clots. And the same thing
Mhm.
with estrogen replacement therapy, it's the blood clots. And that Women's Health Initiative study showed 22 per 10,000 over placebo got blood clots. Um, Not that many. And it means a lot to those 22 extra women.
Right.
But in the big scheme of things, um, with 6,000 women a day, that's less than 1% having
Mm.
a problem. And we stopped a great treatment for women because this one study, and Dr. Booth, you know that one study does not change medicine. When a study comes out, doctors around the world, researchers around the world, redo that study over and over again,
Mhm.
trying to get the same results. And if everybody starts getting the same results, that changes medicine.
Right.
But one study does not change medicine. And unfortunately, they did not put this out in a journal first. They put this out um, on the NBC News first. And by the time
Mm.
it went around the world, the journal came out 30 days later. And by the time it was reviewed by researchers and scholars around the world, um, it, it had already changed medicine, and it should not have. So the risks are overstated. It There is a very small risk of stimulating a breast cancer that is there. Um, you got to look at the whole patient. Does she have a family history? Does she have dense breasts? There's a lot to go into whether you decide to give somebody estrogen or not. But withholding it from all these women, from this gynecologist standpoint, was criminal.
Thank you so much. I know that that information alone, and like you said, like there's so much more that you can talk about, but just that piece of information that you have given is probably turned the light bulb for a lot of people to say, let me reconsider. let me rethink this. And now they need to really have that conversation with their doctor to say, okay, I want to try this, and find the person who is going to support them in that decision. And like you said, there's two different ways you can get your estrogen. You can do it systemically, you can take it by, let it go throughout the entire body to help with overall symptoms if you're having that, or it can just be localized. And the localized is minuscule as far as absorption and getting into your system, causing all of the other issues. So I really, really appreciate that. And I know a lot of people are like, oh my gosh, okay, maybe I need to reconsider this, because there is more to uncover with that. And now let's get into some of the other treatments. I'm excited about it. So you can go ahead and talk about those other treatments that you were going to mention.
So if you have estrogen receptors in your head, which control your hot flashes, in your breasts, which can make them a little bigger, your uterus, which can make you bleed, and then all your pelvic tissues. And that's the most important thing that I want women to stimulate is their pelvic tissues. So their bladder, their vaginas, their rectums, all the connective tissue around there. Um, the vagina loves estrogen. She wants to suck it up. I always tell my patients, you have receptors in your vagina for estrogen, okay, and all those pelvic tissues I mentioned. And, and a receptor is like a catcher's mitt, okay? And that receptor is in there, even if the cell is all shriveled up. And if you give that receptor its molecule, in this case estrogen, so think of it as a catcher's
Mhm.
mitt. The catcher's mitt loves to have a ball because you got to strike, right? That estrogen receptor loves to have its estrogen. And when it's in there, in that receptor, that cell works great. It's thick and luscious and it brings the blood supply in. And that cell functions good. And all those little macrophages and all those delivery systems work really good. When you take that estrogen away, the cell shrivels up and gets
Yeah.
small. So if you don't need systemic estrogen for hot flashes, for goodness sakes, take care of your vagina. There is no evidence that vaginal estrogen causes any blood clots or breast cancer. They have to put that on the package inserts
Mm.
because of the FDA, but there has never been any study that showed topical local estrogen causes breast cancer or blood clots. And I feel so strongly about that that I feel like we have done a disservice to breast cancer patients by not continuing
Mm.
to um, take care of their vaginas. One of the other things that I do is survivorship medicine, which is um, uh, it sounds like it's surviving something, but it's really OBGYNs call it survivorship medicine in that we're trying to keep people sexually active even through a terminal illness or a
Mm.
bad illness. Okay, so let me explain that. Lung cancer, okay, um, lymphoma, Hodgkin's disease, um, cancers that we can treat, and people may have more of a chronic disease like diabetes. You
Mhm.
treat the cancer, it goes away, they're in remission for a while, maybe it raises its ugly head again and it comes back. But let's just take a Hodgkin's lymphoma, okay? And you are treated for maybe 3 to 5 years. You have a miserable 3 to 5 years. You're getting chemotherapy, maybe radiation. But at the end of that, right? You wouldn't tell somebody that Hodgkin's lymphoma is a death sentence, right?
Right.
It's going to be terrible to treat it for a while.
Mhm.
But you have a couple who's sexually active and intimate, then they go through this treatment plan and they probably are not intimate during that whole time. But the radiation and chemotherapy all dries up your vagina, may shut off your
Mm.
estrogen, may shut off your ovaries. Well, then you're done, and now you can't have intercourse. What if they're only 40 years old? You've
Right.
taken away their ability to be intimate for the rest of their lives.
Mm.
And the oncologists are terrified of estrogen. There's no reason a lymphoma patient or a lung cancer patient or a cervical cancer patient can't take estrogen. It has nothing to do with that type of cancer. They're
Mm.
just frightened to do it. But what I try to do with survivorship medicine is tell these women, you can protect your vagina. I know this is a horrible time of your life, but when this is over, and it will be over,
Mm.
you're going to want to get back to normal. And one of the things getting back to normal is having intercourse again, being intimate again, getting back to your job and your family and everything else. So, the things we have 6 things that can protect your vagina. Two, one of them is estrogen cream, just an estradiol cream. And we look at this little applicator and we think, oh my gosh, I'm going to have my vagina full of stuff. And when I get up to go to the bathroom in the middle of the night, it's going to all fall out. No. Okay. It's 1 gram. This one little, oops, this one little area right here at the very top, 1 gram. So I don't know if you can see the gram there. So we're not talking about
Mhm.
much. And that's just every other night. And these creams are formulated to stay on your walls of your vagina. So if you can put them on, I'm doing this backwards, it looks funny. So if you can put it on with your finger, like push this into your palm, take it and kind of wick it up there, it's not going to come out in a big glob and it's not going to be
Mhm.
as terrible. Um, the second thing is a vaginal tablet of estrogen. This is a Vagifem or Uvafem is the uh, generic name. And you just put this little tablet up in your vagina with an applicator that comes all pre-done. You click it up in there, throw it out, and you do it 2 days later. Now, your vagina has to have moisture for this to work. Okay.
Mm.
So if I take this little pill and I throw it up there, we can come back in 2 months and this little pill will still be there, right? But if I throw this in my
Mm.
sink and I wash my hands 300 times a day,
Mm.
this is going to disintegrate. So if
Wow.
you don't have moisture in your vagina, this is not going to work. Okay, so sometimes I do a speculum exam and I go there and there's 4 pills up there and I'm like, you need to use a moisturizer, okay, because this isn't working. The third thing is a ring. And this ring, it's a silicone ring, is impregnated with OBGYNs love to say impregnated with estradiol. You put it up in your vagina, it opens up and it stays up there and it just gives out estrogen all the time, lasts for 3 months. Expensive. My favorite now is Intrarosa suppositories. Oops. So this is a suppository that you put in every night. You put it in the applicator. You don't have to wash the applicator. It comes with its own applicator for every night. You pop it up in there, and this has a moisturizer in it. This is not estrogen.
Mm.
This is DHEA. And you do have DHEA receptors in your vagina, and those receptors can change this into estrogen and testosterone. The estrogen will thicken up the top layer of the vagina, and the testosterone will thicken up the bottom layer of the vagina. Fabulous. And you do not, this is really important, you do not have DHEA receptors in your breast. So if you have breast cancer,
Mm.
this can affect your breast or your tumor because the tumors and the breasts do not have DHEA receptors. Okay, so the American Cancer, it's ASCO, is a society. They actually recommended this for patients with all types of cancer. Okay, because it's not estrogen. And then we have a tablet for women who don't want to put something up in their vagina. We have Osphena, and Osphena is a SERM or a selective estrogen receptor modulator. Somehow you can take this pill and it blocks the receptors in your head, it blocks the receptors in your breast, it blocks the receptors in your vagina, but
Mm.
stimulates all those pelvic tissues. So if you don't want to put something in your vagina, this is great for you. You can just take a pill every day. Okay. And then the last one is called Imvexi. And this is a little peach suppository that you put up in your vagina. This has got estradiol in it. It's kind of cream in there. Once this dissolves up in there and you do this every other night. That's all we have. So if you are postmenopausal and planning to be sexually active for the next 1/3 of your life, okay, we spend 1/3 of our lives in menopause. Do you think you're never going to have a partner again? You
Hmm.
know, if you told a 20-year-old you'll never have a partner, oh, they look better than us. But at 50, that's a very common time for women to get divorced, right? Our life expectancy is 90. Do you think that you're not going to find one person
Hmm.
that you want to be with in 40 years? I think that's unreasonable. But women let it go, and then they come in at 65 or 70, and they're like, "I got a boyfriend. He can't get the tip in. I need you to fix this." Well, if you have been without estrogen for 15 years, okay, your vagina is
Hmm.
going to be dried up, and it's going to take me more than a week to get it back. It may take a year or two to get it back. You can get it back.
Hmm.
But what my project with the book and the movie was, don't let your vagina get there. Protect her. We have stuff to do it. Some of it's a little expensive, but you can protect your vagina till you're 90 or until your husband doesn't or can't or won't have sex anymore, and then you can let it go. But why do that at 60 when he can just go to his doctor, and if they haven't had sex in a long time, it takes a man on average 5 to 7 years to ask their doctor for an erectile dysfunction drug.
Hmm.
Okay. But unlike women, if they haven't had a good erection in 5, 10 years, okay, they take this pill, it works in 30 minutes. Okay. So they don't have
Right.
to get it back or anything. They can come home and go, whoa, we need to take care of this. Right. But if she has not had sex in 7 years and she's postmenopausal, this is not going to go well. In fact, I have one of my things is I don't think physicians should give erectile dysfunction drugs to men until they talk about at least or evaluate the partner. Because when they just give this, um, say, prescription and say, here you go, buddy, 30 minutes, it's great. You take this, you're in business, right? That doctor is handing that man a weapon, in my opinion. Okay. He wants to use it. And I'm very happy that it works that good. It's one of these erectile dysfunction drugs are one of the best drugs that ever came out in my career. Okay. With 30, almost 35 or so years. Okay. It does what it says it's going to do. It has very few side effects besides what you see on the thing of losing your hearing and passing out and all this stuff. Very few people have side effects, or they wouldn't let them sell it on TV without even
Right.
seeing it, right? Um, and it works. So they're great drugs. But this is what should happen when an internist or urologist or family doctor gives out one of these ED drugs. They should hand it to him and say, "Here you go. It'll work in 30 minutes." And before he takes it, they should pull it back and go, "But first, let's have a talk about your partner, because if you haven't had sex in a long time, this is not going to go well and can actually destroy your marriage." So,
Dr. Pam, I'm glad that you mentioned that because I worked in a men's health clinic, and that was a lot of what happened. A lot of men would come in, they want their treatments, they want their meds, and then they say, "I am going to go home and do all the things with my wife." And I said, "You're going to have two problems. The first is like you said, the issue on her end, there may be something there. But the other one too is some relationship dilemmas can come into play because it's like, wait a second, you haven't been able to do the things for some time now. And all of a sudden now you can do the things. Now, have you been doing the things with other people? Or, so it is a big discussion that I would have to have. And I'm glad that you mentioned that because people can get into a lot of trouble just taking that pill and saying, "Okay, I'm ready to go."
yep, it's a bomb with a mushroom cloud. You have
Right,
the initial bomb, and that may hurt, right? But then the
right.
collateral damage going out of relationship problems, hurt feelings, um, cheating. Um,
Mhm.
because I know they got this back. It means a lot to a man, and they want to use it. And I
Right.
love what they do. I have nothing against men or them doing this, but you have to think about your partner in these situations, and it has caused terrible, terrible relationship problems, divorces. Um, it's can be a nightmare.
Yeah. The other thing, Dr. Pam, that I absolutely love that you talk about, and you do it in a medical way, another way to protect the vagina, vibrators. And
Yes,
I've never heard anyone talk about it like you talk about it, because there's such a stigma around vibrators, and they think that if a woman uses it, it's certain things and people look at her a certain way or whatever. But you talk about, okay, listen, this is a way to protect the vagina. And I love that you say if you don't use it, you lose it. So talk to people about how a vibrator can actually help, because I love that you say it's not just women who are in a relationship with someone. This can help those who, like you said, once if they get divorced or whatever, then they can use it later, use it until they find that partner or whatever. But can you touch on the importance of vibrators and why
I
medically it can help?
I would love to. So here is what I hand out to my patients is Dr. Pam's recipe for your vaginal health. Okay? So when you come in and you are around
Mm,
48 years old, I go through the three ingredients for my recipe for your vaginal health. Number 1, vaginal moisturizer. Is there a woman out there listening to me that doesn't moisturize their face? No. Probably in the morning before you put on your makeup and then at night before you go to bed, especially if you're over 50. Okay? So, did you you moisturized your whole body, right? You probably put on your moisturizer, put on some makeup and then moisturized your whole body, right? Did you moisturize your vagina? No, we don't think about
mm,
her, but you have to think about her. She's dying out there. She's like a doctor, right? Dr. Booth, wash your hands 400 times a day. And in the winter, do you ever, at like on Friday, do you ever bend your hand and your knuckles crack, right? Because they're so
mm,
dry. Okay, we are
mhm,
constantly putting on moisturizer. Well, that's what your vagina is like without estrogen. So moisturize her. Coconut oil. My favorite moisturizer, it's called Just Like
mm,
Me, and you can find it online. I sell it in my store. But you got to use a moisturizer. I use it every single day, and here I'm telling the world, I moisturize my face, my body, and then I moisturize my baby. Okay, because she is not going to look like the vaginas that come in my office. All right, so that's number 1 is vaginal moisturizer. After menopause, before menopause, you don't have to worry about it because you have estrogen, and your estrogen moisturizes your vagina. Number 2, vaginal estrogen receptor stimulators. And we just went over the 6 types: the creams, the tablet, the ring, the DHEA, the tablet that you swallow, and the little suppository. Those are the only options that we have. So moisturizer, vaginal estrogen receptor stimulator, because we want that receptor
mhm,
strong and luscious and thick and healthy. And then the third is physical therapy. So say you're 53 years old and you're divorced and you're doing like so many women do. They come in here, they're like, I don't even know how to date, and they date online now. And I'm scared to be on an online thing. And I'll never find anybody. Well, it is harder to find somebody after 50, right? They say after 40, you're never going to get married again. That was old. But it is harder, and we don't know how to date at our age. So, if the best thing you can do to protect your vagina is to use it, right? If you don't use your arm, say somebody has a stroke and they're in the hospital, and we take care of their stroke, and then we send them to rehab, right? And the rehab people are moving that arm and everything, and then their insurance runs out and it's 6 weeks, and we send them home, and we tell the family to do this, and the people get mad because they don't want to do their exercises because they just don't want to. And what happens to that arm, right? Arm, leg, if you're not using an
mhm,
organ, it shrivels up. If one of your kidneys is not working, that one shrinks up, the other one gets larger.
mhm.
Okay. The vagina is the same way. You can do great. This is where the men love me talking. The best thing you could do for your vagina would be to have intercourse every day. Okay. Work it out. Go to the gym. Okay. But that's unreasonable. But if you don't have a partner, this becomes a problem because physical activity for that organ is very important. So there are two reasons for a vibrator. One is pleasure, knock yourself out. Okay. I don't even care about that. I'm happy that you're having an orgasm and, you made my day. But what I'm talking about it is for physical therapy. And so what I do is I have a patient take a vibrator who doesn't have a partner or it's too painful right now and we're working on getting her
Mm.
vagina back working, turn it on and put it in there. Okay. You can take it out, put it on your clitoris, have an orgasm, enjoy, but put it back in on high vibration, put it in there, watch TV, read a book, whatever. The vibration
Mm.
is going to bring the blood flow. It brings the blood flow back. You can use a dilator. Okay. So we have dilators and I have very small, some women we start even with very small ones and we have to work up
Mhm.
the larger ones. Okay. This will stretch the tissue out, but this is not going to bring any blood flow back. It's just
Right.
sitting there. The vibrator will make the blood flow because you're using it. Okay. So Netflix, binge watch something, read a book, and the more you do it, the more you bring the blood flow to the vagina, the quicker it's going to heal. Just like any injury to any part of your body. What do we do when you get a knee replacement, right? We send you to rehab. You're working that. You got to work it out. And when you go home, you got to do that at home. If you sit around and sit in your recliner and never move, that knee is going to bind up and it's going to hurt when you want to work on it.
Mhm. That's awesome. Dr. Pam, I'm going to take a moment to look at some of these questions because people are really excited and they are engaged, which I love. And so I'm just going a second to look at some of these questions to see what people have. Now, there's one that said there's someone who they believe was going through menopause and they are having like some brain fog. Is that a common symptom?
Oh, yes. You know what? We don't have it's like birds flying south for the winter. So birds fly south for the winter, but then they come back. But your
Uh,
memories in menopause, they fly south, but sometimes they come back. The big thing to know, and we're older, our brains don't work as well as we get older. The best thing you can do is keep working. I try to do puzzles to keep, fresh. Sudoku, all those kind of things that you are engaging your brain all the time. But memory loss it comes with age. And then for some reason, when you lose your estrogen, you have estrogen receptors in your head. I mean, it's true. It's 100% true.
mm,
We don't have a cure for it now. Um, if I can ever find something that will work to bring our memories back, then I'm going to quit doing pelvic exams. That's for sure. But yes, brain fog,
okay.
memory lost.
Okay. And then the other one says Divi Gel topical. What are your thoughts on Divi Gel
Okay,
being topical?
Divigel is a topical systemic estrogen. I love Divigel. It's actually one of the cheaper ones, and so I prescribe it a lot because there aren't that many options. Like the the more easy it is to put on the estrogen, the more expensive it is. For instance, here is Eva Mist. Okay, you take this little sprayer, you spray it on your arm one time, you wait 60 seconds before applying clothing, and that's your estrogen. The Divigel is in a little packet, and you open the packet up. I usually have some sitting around here. You open the packet up and put it. There it is. It comes in a adorable little purple case, which will not fit your credit cards. but it's very cute.
And it's cute.
And the Diva gel is a packet of gel, and you just tear it open. And I tell my patients to put it in their groin, and you just rub it around your groin and upper thigh, and that gives you your estrogen. Um, there's a there's a gel like hand sanitizer, okay, that you just squirt on there, and then you rub in on like hand sanitizer, and that goes on your shoulder. So those are three options right here for systemic estrogen. Now, if you have a uterus and you're using um, one of these systemic estrogens, then you have to use progesterone with it so that you don't get an overstimulation of
Mhm.
estrogen in your uterus. If you have a hysterectomy, you can use as much of this as you want and not worry about it. But that's systemic estrogen, which comes along with those low risks um, of breast cancer and blood clots. But I love
Okay.
Divigel. I love all of them. It doesn't matter to
Okay.
me
Good.
what people pick to get their estrogen. Transdermal is a little bit safer than taking a pill or a shot.
Okay. Okay, good. And there's one other thing before we move on. When we talk about this, I know some people are like, "Oh, intimacy or keeping my vagina together." Okay, whatever, blah blah. But I don't think they understand the full picture of it because this is just kind of like pelvic health and stuff in general, and you put it in the dichotomy in the fact that some ladies start to have issues with urinary incontinence and stuff, and how again you said this is kind of like PT. This is physical therapy. And so once you do that, you are able to strengthen those muscles, get those things together, and that can help along with those type of symptoms. Am I correct in mentioning that?
Absolutely. All the tissue around your bladder, um, usually I have a balloon right here. I do. So I have a balloon here. So this is how I explain it to my patients. It's my Georgia balloon because I'm a Georgia dog. Okay, so there are estrogen receptors all around this area of your urethra, going from the outside to the bladder. Okay, if you have no estrogen, these are all atrophied, right? But we want everything
Mm.
around this urethra or the tube that you urinate through to be thick and strong, and there's these little muscles around that um, urethra, the tube from the outside, from the bladder to the outside, that shrivel up when you have no estrogen. So using estrogen to thicken up those estrogen receptors is going to make those muscles stronger, and just like going to the gym, right? You can tell, you can look at a woman and tell, oh, she lifts weights, right? Because I covet their arms. You can tell when somebody's working out good and they have these beautiful arms. I'm like, I could wish for it all the time, but I don't go lift weights, right? So I'm never going to have those kind of arms. Or maybe when I retire and I can get some time, but you can get those muscles back in your urethra. Just give them some estrogen because they're all shriveled up and atrophic, and they're just, those receptors are waiting for estrogen. That it loves it, just sucks it up and makes those cells work good.
Okay, great. Thank you. Now, we're going to pivot just a little bit. Again, if you are just now tuning in, I am talking to Dr. Pam. She's a board certified OBGYN. She's also what I consider the menopausal expert. She has some additional training in intimacy counseling. She actually got some certification from the Florida Sex Therapy Institute. And I like that she says she doesn't really call it sex therapy. She calls it more intimacy counseling, because what we know is that a lot of this it surrounds intimacy when you get with couples and discussing this. How do you help couples to be able to walk through this phase of life, the female and the male? Like, how do you help them to be able to go through this transition and approach it and help them have these difficult conversations, because it can be something that someone may feel uncomfortable talking about, may seem a little embarrassing. However, but how do you help them to be able to have those conversations and rekindle the romance?
Well, great. Oh, I wish I had 2 hours. So if I can get men and women around age 50 into my practice and say, this is the perfect age for you to come here. I have you. I'm going to try to keep you active for the next 40 years. Intimacy is so important to a marriage. You lose a big part of your marriage when you lose your intimacy. And some couples do fine with it, but you can get an audience full of men from 50 to 100 and say, who has erectile dysfunction here? And nobody's going to raise their hand, right? Of course they won't. But I tell them 50% of you over 50 have erectile dysfunction, 60% over 60, 70% over 70, 80% over 80, 90% over 90. Okay. It just doesn't work without some help. So don't be embarrassed. Expect your doctor doesn't care. I mean, they're sexually active too. I mean, the men, they want to go home and hopefully have sex that night. And to men, sex, the act of intercourse is an I love you. Okay. That's how we show they feel loved. When they are regularly sexually active, they are on top of their world. Nobody can take them down. They know that their wife loves them, cherishes them, is attracted to them, despite what they look like. You are her treasure. And you say yes when you want to have sex. She says yes when you ask to have sex. For women, not so much, right? You holding my hand in public and giving me a kiss in public. So I'll give you my best example of I love my wife. If you come to her office and bring a picnic basket and say, I know you're really busy and you can't leave for lunch, so I brought a picnic and we'll have it on your office floor. And all her coworkers hear her, right? It's about the intimacy. It's holding me and comforting me when my best friend tells me that I'm put on weight and she hurt my feelings. And you come up and hold your arms around me and say, you're so beautiful and I love you just the way you are and you're not fat and that was mean and let's leave her. Let's not talk to her anymore or something. That's love. That's how we feel loved. When you take care of me, protect me, and protect my feelings and make me feel safe and secure, and you want to hold me and love on me. Okay. Sex, not so much, right? As we get older, it's not as much.
Right.
Some women really can't wait. So we got to talk in each other's love language. Okay. There are some times that my husband will come up and say, you want some? And I'm like, I'm doing my charts and I'm working hard. And when you get in mode and you're really getting a lot done. And I'm like, are you kidding me? Are you kidding me? I wasn't thinking about anything like that, right? But my behavior when he does that, okay, changes his world. If I go, no, I'm working and now I'm out of mode and now I can't get back in it because I was getting so much done and no, right? That is a rejection, even from your wife. One of the things in my sex therapy classes, intimacy counseling classes, is we had men and women come in and we were allowed to ask them anything. And one of the things that struck me the most was how men feel rejected even after they've been married for 30, 40 years when she says no. But if I do this, if I go, I sit there in my head and go, oh my God, you're an idiot, right? But if I push back my chair and go, oh yeah, I've been thinking about it for an hour, you better run, right? And if I participate in this event, it could be over in 5 to 7 minutes, right? If I'm engaged and enjoying it and not thinking about how old I look and that my breasts are hanging and that I have my flab is moving more than my body is and how terrible I look. He's not looking at that. He's in his world. He's so happy. I can be back at my desk probably in 15, 20 minutes and I won't be messed with the whole rest of the night, right? So your response and knowing that is an I love you to your husband will mean everything to him. How you respond will help your whole marriage, eh, and keep the intimacy going. And and if we're honest, even if we don't want to do it, once you start doing it, I don't know how many times I'm like, I don't know why I avoided this so much. It's kind of nice, right? But for women,
Yeah.
the arousal comes after you start doing it. For men, it's different. So um, keep things spicy. Use toys. Okay. It's boring to have sex with the same person for 35, 40 years, right? You run out of ways to do it and things to do, and you don't want to try anything new and stuff like that. So get some new things or go have hotel sex, go into a hotel. Everybody has better
Mm,
sex in a hotel because, there's no kids around. It's kind of fun. But this is with your husband. You're not doing anything nasty if you're
mm,
using toys or arousal oils. One of my favorite things to give women, especially if they're having difficulty with orgasms, is on arousal oil. So hopefully everybody's going to go on and get online. It's Sensuva, I think, is the company, but on arousal oil. Um, it's wonderful. You put it on your clitoris and the surrounding soft little area, and it's got nothing in it but essential oils, and it warms and tingles, and it brings the blood
mm,
flow. And you kind of want to touch your clitoris or have somebody else do it. So it's an amazing thing, and there are all kinds of them. There's menthol ones, and there's cold ones, and warm ones, and but those are things you're doing this with your husband. This is not
mhm.
pornographic. This is not disgusting. This is keeping your intimate life at the forefront, which is good for both of you and very good for your marriage. My whole goal is the prevention of the dissolution of long-term
Mm,
marriages because of a lack of intimacy, okay, which is a
yeah.
huge part of why marriages dissolve. So
Yeah.
maybe I can put the seed
That
of it.
yeah. No, that's awesome. Very beautiful, very well stated, because you're absolutely right. This is saving relationships. And once you save relationships, like it just snowballs into a lot of other things that happen. You've given us so many gems, taught us so much information on today. Did you have any other tips or comments that you wanted to make, that you said, oh, if I had to say one more thing, this is what I wanted to say? Because I want to give you that opportunity.
Protect your vagina after 50
Yes.
and just moisturize. Even coconut oil will work as a moisturizer. Moisturize. Think about the 6 types of vaginal estrogen receptor stimulator and go to the gym. Keep her working out. And if you have a husband, get him taken care of and encourage him to talk to his doctor because sometimes the men don't want to get help. So
Mhm.
keep your intimate life at the forefront. It's very good for your marriage.
Awesome. Thank you again, Dr. Pam. Like, this was awesome. It was, I mean, truly, it was really, really good. You guys want to make sure that you follow her. She has the Georgia Center for Menopausal Medicine on Facebook, so you can go on there, and she posts, things pretty regularly on that site, so that you can stay up to date if you are in the Savannah or surrounding area. Look up her practice, establish a relationship, because not only are you getting this information, because as you can see, she gave us so much, but if you want that personalized attention, then you want to definitely look her up so that she can take care of you. She has a store. So she also has an online store. So some of these things that she talked about, she has vetted personally to say, yep, this is a good one. Nope, this doesn't work so well. So you can go online. I'll put the links to all of this stuff for you guys to make sure that you know. But that way you can order some things in the privacy of your own home, very discreetly, look over it with your partner and say, oh, yeah, this looks good. This is what we want to try. That way you can see what makes the most sense for you. Get the book Love, Sweat, and Tears. Me as a physician, I learned a lot. And then I coupled it with the docu-comedy that was really good, because not only is it informational, you get a few laughs in there and you're like, oh, okay. And so you don't really feel like you're like learning. Like, there are things that come out at you that make you say, oh, that's very interesting. I didn't know that. So, Love, Sweat, and Tears, you want to make sure you look that up because she gave us so much information and has so many tools. We want for you guys to continue to have this discussion, to start thinking about what's happening with your body. Make sure that you have one on your team who can help you with that. You want to have the discussion with your mom, your sister, your aunt. Hey, what are you experiencing? How did you go through this? So that you will know. Have a watch party with your girlfriends and, girl, this is what I'm going through. Did you go through this? These are some things that we can use to help because you're helping each other. But that is it for now. Make sure that you share this, you like it. Also continue to follow. I've told several people to also put on your notification bell so that you'll know when we're putting out new content so that you can stay up to date on the things that you need to know so that we can ultimately help you live your best life. That's it for now. Take care, and I will see you soon. Bye bye.